Okay.
All right.
We'll save the main event first.
All right.
Good morning, President Warren, and members of the board, for our briefing session here today. I have a few topics just to update you on. One is hours of service. And first of all, you recognize about 8 days ago, we did sign an interim agreement with the ATU on the hours of service agreement. And that is a policy, an interim policy until the next contract that really just deals with bus operators. Recall that train operators were already covered by an hours of service policy that was in place based on Oregon administrative rules. The new policy, again, defines a service day the same way that for bus operators as we do with rail, so that was a good change. And it will begin to require 10 hours off for most bus operators and 9 hours off for the extra board operators. The relief operators represent about 19% overall of our workforce. So this will completely eliminate the double back shifts where people worked a number of 20 hours or whatever the large number of hours was in a 24-hour period, and require between assignments additional time off. So we're really pleased with that agreement. We know that that will be an improvement to safety overall in the system. But also emphasize it's a temporary agreement. We need to get back to the negotiating table with the ATU and with this issue as well as many others that we'll talk about during the State of TriMet presentation. There are a lot of things to work through with the union. And this is particularly one where I think there's a lot of opportunity for win-win situations in terms of more humane schedules as well as an improved safety operation for TriMet. I would let you know that we're working through the steps of the implementation of this agreement. I wish this were as simple as snapping my fingers and making it all happen. But you know the agreement includes sign-ups that occur on a quarterly basis. Our bad luck is the last sign-up for the March period had already been completed when this agreement was noted. So we're now working with the union about how to implement this. We will certainly implement for the extra board operators where most of the problem occurs as soon as we can get our programming assists reprogrammed to accommodate this. And then we'll work with the union about how to implement it even in a March time sign up for operators. Now we may not get to the full separation right away until we do a full new sign up, which will be in June. And so certainly in June, all the new standards will be in place. But there will be some phasing that I wanted to make clear to you. So again, I'll stop there and see if you have any questions on that topic. I think again it's a positive development, and we're working to implement as quickly as we can. Yes, sir.
Since we'll be phasing in that hours and service thing, will there be working with supervisors and stuff to do kind of closer monitoring to make sure that no one's heading into a problem?
There's two aspects of it. One is both closer monitoring, but the other is retraining our station agents who are the people who actually call down the relief workers. And so to make sure that both our data systems indicate when there's a problem and that they're aware of it and know what actions they should take in order to avoid it in the future. Ultimately, this will require more operators at TriMet, so we will be including that additional number of increases in our budget that we bring forward to you next year.
Any comments or questions? Good. Well, thanks to the staff and the union for sitting down and hammering that out. Look forward to the final resolution as we look into hopefully a contract that we're going to look at that means this as part of the overall contractual rate.
And my thanks again, as I've expressed a number of times to Randy Stedman and Shelley Lomax, who actually continue the yeoman's work in implementing this policy. Quick update on training. I wanted to bring you up to date on where we are with our annual recertification. You might remember that was a key implementation recommendation out of our safety task force actually a year and a half ago or so. And we are nearly through, or halfway through, recertifying for the second time now all of our over 1,000 bus operators, and on track to complete that training by mid-May. So it's going very well, getting very good reviews as it did last year from the operators in terms of feedback on the classes. They're asked to do the evaluation at the end of it. The key areas of training this year are really identifying and mitigating risks that they see, how to identify risks and how to respond accordingly. We also have a major segment this year on customer service, and it really comes back to the basics, which is, present a professional image, greet your customers, show respect, provide information, expect questions, and get help when you need it. Those are sort of the keys that we sort of emphasize to all our offers related to customer service. And then the final area we're doing is actually stressing wellness and the need for people to take care of themselves, and the operators to take care of themselves, both as it can be a high-stress job. And I know from personal experience in high-stress jobs that it actually takes a lot, it really helps a lot to get some exercise and the time down. So we're emphasizing that to all of our staff as well. I'd also just note on that front, we're also, once again, sponsoring teams for the Heart Walk this year in May, and so we're beginning to organize that, beginning to organize teams to participate in that. So a nice annual event at the beginning of the summer that hopefully keeps people off until a little more ready to reset the level. Also related to safety, wanted to let you know that we've got another opportunity to advance the safety of the system. We heard just this week that the Federal Transit Administration selected TriMet for a $400,000 grant to test and evaluate the newest technology for pedestrian warning systems. Now, you might remember that these are essentially audible alerts for pedestrians and cyclists as their buses turn in particular. We did do some tests in 2011, a couple different vendors, and as you might recall, our results were not particularly great. We found that they either went on when they shouldn't have, or went on too soon, or went on too late. There were a lot of different problems in terms of getting that. We've been told, and the vendors believe that they've substantially improved the technology, so we want to go back and test it again. And actually there'll be 3 different vendors' technology that will be testing and doing an actually scientific evaluation of that from the standpoint of both the safety and there's perception with operators and those on the sidewalk and the street who hear it. And we'll be actually running those tests on 5 different lines this year. So we're really pleased to do this. In this regard, we're really piloting for the whole industry, which is very interested in these pedestrian warning systems, and so it's a chance for us to really begin to see what works and to begin to develop, and hopefully, a lot better technology than we've been able to see in the past. And finally, and I will certainly update you on that as the testing continues. I also wanted to just note related to mobile ticketing. I get my software installed on Friday, and so I will be the ultimate test in terms of the dummy amongst us. But we actually are continuing to progress this mobile ticketing application that we have with Transit Sherpa. We've been testing it now with a number of employees who have it on their smartphone. We're getting a lot of positive feedback also as we show this to the operators right now, because we're all part of this communication effort is also to make sure the operators get to provide us the feedback in terms of the effectiveness of the ticketing and the security measures that are built in on the screen as they see it. And on Monday, we expand the number of employee testers. The other part of it will actually be credit card transactions, so we'll be able to see how the credit cards interact with the application itself. And so that will be a significant milestone. We're hoping that in April we'll have what we call the beta test with about up to 200 community members who are volunteers on that, just to begin to see how it works for them. So if all goes well, we'll be in a position to roll this out to the general public in this summer. So we're very excited about that. It's a great application. It means some people don't have to rely on the ticket vending machines. That's a good thing from our standpoint and probably from the public's. But I think it will create another, very attractive option to make TriMet competitive. So with that, Mr. Board President, those are my comments, and if there's any questions or follow-up on any of those topics or others, I'd be happy to respond.
Okay. All right, I think you've covered it.
All right, very good.
Thank you very much. So, wandering on to the state of TriMet.
You may be hearing more from me than you want this morning, but actually, I'm going to ask Dave Auxier to come up to the table as well to help answer questions as they come up related to the state of TriMet. But I am privileged to report to you the state of TriMet board and the community. I think this is the first of a number of conversations we want to have about this and make sure that our region and our riders and our citizens actually know the state of TriMet as we enter budget deliberations for the next fiscal year. We know that in the years ahead, our big challenge is to find a way to fund transit service that our region needs, and we also know that a key to that is reforming our labor contract. And I'll go through that a bit more. In my view, this is really an SOS to our community, save our service. This is really an important message that I think we have to get out, that there is a lot at stake in our deliberations over the next year. We continue to face a number of financial uncertainties, and I'll certainly go through those. Most of those we are managing our way through. And we are enlisting the best management practices we can come up with to define and manage some of those uncertainties. But we cannot override the structural issues that we need to fix in order to ensure our future. So looking generally ahead to the fiscal year 14 budget, which you'll see in draft form beginning in March, three things really sum up where we are. Even with some of the financial uncertainties we have, I'm optimistic that we're on track for fiscal year 13. In other words, our plan that we established last year is working, and we are on balance, strong. And it also sets us up well for fiscal year 14. I'd also note the second point is that with our arbitration award, and as you well know, that is being heard by the Employment Relations Board. For these statements really depend on whether or not that award is sustained. But if that is sustained, we have some breathing room on our budget. But I would emphasize that TriMet's long-term future, financial future, is still in jeopardy. Fiscal year 14 will be important because it will begin to lay the foundation for the long term. And it will help determine when we can get back to growing service. And let me go through some of that information as we move along. First, I wanted to just emphasize to you again how important TriMet is to the overall. Last year, fiscal year 12, we saw 102 million rides on the system. Demand continues to grow. We're 24th as a region in population and 9th in per capita ridership. So our region continues to support TriMet, and we have very strong ridership. We're leveraging some very innovative new partnerships. For example, a program to develop more sidewalks and pedestrian facilities and bus stop facilities in East Portland has been funded by the Metro MTIP program in conjunction with the City of Portland. Also in Washington County, we're seeing investments in sidewalks and bus stops and other amenities that make our transit service more effective. And we're continuing to build really efficient service with the Portland to Milwaukee project. All of this, though, comes with the footnote that we're unable to really meet the needs of our growing region. Everywhere we go, there are more and more requests for additional service. So we'll go through that a little bit more, but the basic problem that we have here is a structural imbalance in our costs. This chart shows the imbalance ahead. In fiscal year 17, if we maintain the status quo union contract and don't get what I would call common sense healthcare reform and other contract compromises from the ATU, we will need to cut $19 million in service. That's a stunning number, and I'll show you shortly what that really means. If we actually lose the arbitration that the ERB is considering at this point in time, that was awarded to us in August, those cuts may need to start sooner. The key piece when you look at this chart is, besides in addition, not considering the Portland-Milwaukee Light Rail project, which we will obviously start up and offer great service on, we will not be adding any substantial new service. We will fix some service problems over time, but we will not be adding any new service. But the key thing is this structural imbalance in our contract, which actually, as you know, is really due to medical costs. This is a chart that demonstrates what the current ATU average cost is per employee for medical benefits. That's over $22,000 right now. Compare that to what TriMet's non-union employees cost, and what the state of Oregon PEB plan costs. I would tell you that the state of Oregon plan and the TriMet non-union plan are excellent medical plans. It's not as if there is a lack of coverage or a lack of quality in those plans, but it begins to tell you what a difference the current ATU contract has as compared to those other plans. Now, I just want to give you one sort of, what does that mean to us? Well, if the ATU were in the PEB plan and we were paying PEB rates for those employees, Public Employee Benefit Plan, by the way, that would mean to our budget $10 million a year. And that would allow us to restore all of the frequent service that we cut during the Great Recession. So it's a huge driver of our costs. Remember that the ATU is roughly 83–85% of our total employees. So the cost structure associated with the ATU contract really drives the finances of the overall agency. So when you start looking at this, this is really about fairness to our riders. And it means that we do need some common sense compromises back to excellent health care plans, such as we provide for non-union employees or a PEB plan. But we need that level of common sense to begin to apply to the ATU current plan. So as you know, we have proposed to the union a new contract. We posted that on our website, TriMet.org/new contract. It would change the ATU health plan to be the same health care plan as non-union employees. It would reduce medical retiree for new hires and employees who are not yet vested. And recall that one of the key drivers of our finances is the retiree health care benefit that TriMet offers, which after 10 years of service of an ATU employee service at age 55 allows complete medical coverage, not only until they're Medicare eligible, but then well beyond that, till the employee's death, and then if the employee dies and there's a surviving spouse, or in some cases dependents, for 16 years beyond that. So we have two problems. Not only is the length of the coverage, but it's the abundance of the coverage, the richness of the coverage that was really the problem that drives much of this. So if we can reduce that for new hires and those not currently vested, it makes a very big difference. It sounds like a small thing, but it really makes a huge difference. And moving the plan to the non-union plan also makes a big difference. We have proposed 2% wage increases, which is very common in the industry and nationally, and maybe even a bit on the high side when you start looking at some of the settlements from around our region. And then some work rule changes so that we can hopefully encourage better attendance, which is a cost factor that drives our costs. And also allow us to work with community colleges and veteran programs to actually bring direct hires to TriMet rather than having everybody in the mechanics rank work up through the bus cleaner or service worker category. So we're very interested in that for a whole number of reasons, including diversifying our workforce to have all elements of our workforce represent the community that we serve. So the key thing here is that as we reform our contract, we actually do free up money to provide service. And so I want to show you a chart that shows you if the TriMet proposal is accepted, what happens to that chart. And as I say, the alligator's jaws closed for quite some time. And you see that actually the service crisis doesn't occur until 2023. And then it's, frankly, much smaller than what you saw in the first chart in the presentation. And recall that we would have actually 3 additional 3-year contracts to begin to address that, what is really a much more minor variation in the difference between total revenues and total expenditures. So I would also just note that this does not include restoring service or growing service more than the sort of annual fix of problems that we have programmed into our forecast. So only slight changes in bus service. But I think this is the first step toward financial stability, where we can actually begin to say the service we have is service that we can guarantee out there for a long period of time. But it does, comparing these charts, pose that same question that we've posed for some time, is are we a healthcare provider or are we a transit agency? And we're here fundamentally, as you are all committed, to providing transit service to this region. And certainly part of that is providing fair, good quality benefits to our employees. But we have a definite trade-off and a definite inflection point in front of us with this next contract that will define whether we are a healthcare agency or a transit agency ahead. I wanted to demonstrate to you what some of this means in terms of our service map. And again, this is just a demonstration, so this is a little bit sobering. This is our current service in 2015 with the Portland-Milwaukee Light Rail project. It includes 1.75 million bus hours of service, 79 lines, 5 light rail lines, and the west commuter service. So take a look at the amount of blue, first of all. And then think about what a 34% cut would mean to that, which is what we would project with this for 2020 without the kind of common sense changes we proposed to the union contract. 49 weekday lines would be canceled or the equivalent. What we've done on the map is just remove those that have the least productive lines in the system. And you can begin to see what that really means. Now, drive forward a few more years. In 2020, it's a $49 million revenue expenditure gap. In 2025, it's a bigger gap of $142 million. That would mean we have a skeletal system. 70% of our lines would be cut compared to today. 53 weekday lines canceled. So this is a very bleak and stark picture, but a demonstration of what's at stake related to the ATU contract and the need for healthcare reform. Again, relatively small changes, moving to the same healthcare plan as the non-union staff, beginning to reduce for new hires and those not vested, the retiree benefit, will make a big difference over time. And I would just continue to say these are reasonable, common sense changes that frankly the rest of the employees in the region have had to deal with over a long period of time. So this is not new. This is what is happening in our world, and we have to come to grips with it as an agency and as a union. I wanted to note a number of things that we've done already to try to bring this misalignment of revenues and expenditures into balance. First of all, as you well know and have lived through, we've had huge budget cuts since fiscal year 9, largely driven by the Great Recession, but also our cost structure. We've reduced our budget expenditures on an ongoing basis to $43 million. We've increased fares, as you well know. We've cut service by 14%. We've cut over 200 employee positions. Non-union employees had a 3.5-year wage freeze. Non-union employees and non-union retirees now pay more for their health care, 6% of premiums as well as a 20% co-insurance. And we've had to defer some capital investments. Some would argue that there's just lots of mismanagement or wasteful spending, but again, like I said, literally 83 to 85% of our workforce are union. So the benefit structure and pay structure for unions define the financial trajectory for TriMet. So I would encourage everybody, there'll be a lot of, as we go through the union conversations, there'll be a lot of potential diversionary strategies out there. Look at this, look at that. But we have to come back to this fundamental imbalance in our cost structure and the need for common sense reform. We can't continue to rely on fare increases. We can't continue to rely on service cuts. We've got to get the lines to come together with common sense reform. We also can't continue to put off capital investments. And as you know, I've been making some strides and recommending to you in the budgets to actually begin to improve our bus fleet and begin to deal with some of the issues that, as our rail system begins to age, we need to face up to. So I wanted to just note that we are still facing a number of financial uncertainties. First of all, as I mentioned at the outset, the ATU appealed the arbitrator's award. We have done the oral hearing on that. The briefs are soon to be filed, and a decision hopefully will be forthcoming this spring. Again, if we prevail, we have a little bit of time to begin to make progress on financial stability. If we don't prevail, then service cuts and an even larger imbalance come to the forefront. We continue to watch the federal formula funds. You should know that most of the funds are in the come from the Highway Trust Fund, which are actually not subject to sequestration, so we feel pretty good in the near term on that. But, the long-term outlook for federal transportation funding is not good, and that a great deal of demand has been expressed, and actually the gas tax that supports that continues to be the shrinking revenue compared to the needs that the program both on the highway side and the transit side does. So there's a lot of uncertainty remaining on that category. Payroll tax receipts continue to be strong for us, but I would say it is very uneven. We've seen some very strong quarters and we've seen some very weak quarters over the last year. We are pretty close to for the first 2 quarters of fiscal year 13, we grew about 6.6%. We're forecasting for next year, really the next 3 years, 7.58%, a little higher than that. So we're taking an optimistic view of the economy and of hiring. And recall, payroll taxes really comes from, the increase comes from additional employment, inflation on the wages, and the mystery factor that economists call productivity. So we'll continue to watch that really closely, but again, we are trying to be, our projections will be relatively optimistic related to the growth of the region and growth of employment. And related to fare revenue, which is the other major point, ridership overall, as you know, is down about 2%, due almost entirely to the end of the free rail zone. It's been very actually encouraging that we're seeing ridership on the bus system actually increasing year over year. What this is overall is telling us is that, you know, we're revenue's up where we expected it to be, maybe $1 million or $2 million below the forecast for fiscal year 13. So that's a 1 to 2% variation. So very close to where we were on budget. But again, we need to watch that. Ridership has a long-term trend. We had a very major fare change, both with the elimination of zones, the increase in price, and the elimination of free rail zone that occurred for this fiscal year, and we need to watch the long-term trends of that and see where we're going with that. So as we approach the budget, and TREM staff is beginning to put together the budget proposals that will come to you in March right now, the theme that I've given our staff is to fix what we have and pay what we owe. The key areas of what we need to fix, first of all, is, and I guess I'm a broken record on this, is the labor contract. We need to make sure that we really focus on getting the reform, the common sense reform that we need to really change our cost structure for the long term. We also need to make sure that we can do everything we can to keep the service that we have, and that means making some investments that reduce the cost ongoing to the operating budget and decrease unfunded liabilities so that we deal with them now and avoid having to deal with them in the future. We will be focusing on fixing the service that we have. There is a limited amount of money that we can put to that, but we do have some schedule issues and some overloads, some places where the crowding is overtaking us, particularly on the bus system, and so we do need to pay attention to that. If we're successful in retaining the arbitrator's decision, and the ERB upholds TriMet position and overall upholds the decision the arbitrator made, we're projecting no fare increases for fixed route service for fiscal year 14 and no service cuts. So this, again, as I noted, the arbitrator's decision gives us a little bit of breathing room where we can sit back and take a look at what are the real structural problems for the agency overall over a longer period of time and really begin to focus on those. So I do just want to spend a little time. I know I can be, I didn't want to spend all the time on sort of the challenges and the threats, but that is clearly one of the key things that I want you to take out of this presentation is that we do have some really serious threats from a financial standpoint moving ahead. But we have not been standing still as an agency, and we have done a lot in this last year. And you were all part of balancing the fiscal year 12 budget, so I don't need to say too much about that. But we have also created actually the $1.3 million low-income mitigation program, and that is underway, and now 40-some agencies, social service agencies have joined us in offering those discounted tickets. And we're also beginning our mini grant program related to other social service agencies that can offer services to low-income citizens. We've increased fare enforcement and fare compliance. We continue very successfully on track with the Portland-Milwaukee project. It's 35% complete and on budget. We're beginning to update the bus fleet. We have 55 new buses in the region right now. We are actually on track to bring in another 70 here starting in May of this year. New TVMs are being installed around the system, and we have improved our open source trip planner, and we launched and will be improving our real-time customer information with the CAD AVL. It's also got very important operating advantages for us as well. We certainly completed our first binding district arbitration, or almost completed it as soon as we see the ERB decision on the ATU appeal. So we are trying to become more efficient in everything that we do. The new buses, I would note, are there because we have learned that a 20-year bus is no bargain to the operating budget. It costs a lot of money to keep those older buses into service, and so we are actually better off at a certain point in time to bring the fleet up to a good age. And again, our goal is to bring the fleet up to an average age of 8, which means half will be younger than that, half will be older than that, and a maximum age of about 15 or 16. We're standardizing transfers, the mobile ticketing program I launched. We're continuing to develop the electronic fare program that we briefed you on in the past. And just a reminder of a really major investment underway with the Portland-Milwaukee project. It's a very efficient project for TriMet. Our capital share is less than 5% of the total. And it is a very efficient service when put into service, $1.94 a ride, and that compares to on the order of $2.43 for our frequent service buses or our general bus service, which is $3.54. So it is a very efficient way to move people in a very strong investment. So as we begin to move the fiscal year 14 budget through, I would note that we have been underway with conversations with the General Manager Budget Task Force, and I would thank Board Member Prosser for his liaison work related to that. We've internally kicked that off. We're beginning the public conversation right now about our overall fiscal policy with this presentation, and then we would like to roll out to you at your briefing in March the proposed fiscal year 14 budget. And then your March business meeting, you would do the approval, which only sends it to the tax supervisor and the Conservation Commission for comment before you actually hear the final review, do the final review on the budget itself, which is proposed for your May business meeting. And again, the new budget year begins July 1. So that is really the end of my presentation, and I know there's got to be lots of questions, and so I'd like to pause at that point and ask board members questions, and I'll look for a little assistance from Dave Oxer, our CFO.
Good. Thank you. I suspect there are questions or comments. Who wants to go first? Tiffany, please.
So this is great. We had an earlier finance meeting this morning, and this is more what I was looking for. And it's explained very well, Neil, very simply. I do have some questions starting on, well, we'll have to go back to page 3. It's really page 4. You made the comment about if the ATU, the current ATU, was under the PEBB plan, that would be $10 million per year. But we're really talking about or proposing the TriMet non-union plan. Is that right?
Right, we are, but I would also note that the TriMet non-union plan, when translated to the current ATU experience rating, doesn't bring that down to 15,000 per year. It would still be up in the 18,000, 19,000 a year range until we bring the experience rating down. So it factors in a little bit more gradually than. So the TriMet offer is really where we'd be hitting. And I think this begins to illustrate how small the changes we're asking for really are in terms of, and what a dramatic effect they have on the agency's finance over time.
So on the TriMet offer that provided that's successful, is that still 10 a year?
So it
Is
would
there
be
still a $10 million savings?
no, it would not be a full $10 million savings. It would be something far less than that, probably 3, 4 would be my guess.
Okay, but the goal is to get to that?
Yes.
Okay, that wasn't that clear to me. So then going back to page 3, we're looking at 2017 as the date. Yeah, I should know the answer to this, but why? Why isn't that 2016 or 2017?
Well, what we're looking at is the alignment, and actually because of the savings that we accrued, knock on wood, should we preserve it, the arbitrator's decision provided us, it does give us some breathing room. And so those savings are enough for us to, if you will, get to fiscal year 17.
Okay.
But after that, and the point being, that wasn't enough to really change the cost structure in a permanent and sustainable way. And that's what the next contract really needs to do, and let's take a much bigger step at that.
Okay, so that's I understand that. Let's see, my other questions for everybody. So with the new hires and those not vested, is there a number there that starts to help? So if we looked at 2017 again with new hires and not vested, then that does what? Is that adds $3 million or?
Yeah. Dave, I don't know if you know I don't know the exact number associated with that change.
The change in the retiree medical takes a very long time before it impacts the financials. It doesn't have an immediate change in our cash flow projections or those tables that you saw.
So obviously, the sooner we start, the more that's going to help and kick in.
Correct.
So, okay. Those are my questions, but this is very clear. This is great. And I'm glad you put in the goals going forward, but also the achievements. We tend to forget those when we get bogged down into so much of everything else that's going on, and there's quite a lot that's happened. So I think that's great and a good thing to keep pointing out. So this is helpful. Thank you.
Good.
I just want to piggyback a little bit on something that Board Member Schweitzer said. So when would we see that difference? We don't see the impact right away how far out is that?
It would have
I
an-
mean, it's probably hard to project, but,
It will have an immediate impact on our liability, our OPEB liability, but at this point, we weren't going to really start funding that for quite some time. So if we just continue to pay as you go retiree medical, the impact of that change would be fairly minor probably, and then start building over time, and it would be 20, 25 years before it has significant impact on cash flows.
David, just, I mean, my understanding was also that there was what we in the finance world called the normal cost for new employees that we were putting aside into the budget.
what was that?
It's the actual, I guess if we will, it would be like the equivalent of a pension contribution for the OPEB cost for new hires. We've been doing that. So immediately, if you reduce the benefit or change the benefit for new hires, that goes down. So there is some immediate change, but most of the effect is, as Dave said, it's out in out years. It allows the system to have, reduced liability and reduced cost in out years.
So, thank you. So my second question is, so I'm thinking of, so folks who aren't vested, I'm just thinking, where are we in line with other agencies in terms of, what does it look like for TriMet in terms of what we're trying to obviously do for healthcare and those folks who aren't vested? So where are we with other large agencies that might be some comparability in terms of where we're at?
Well, I would say that we are alone, head and shoulders above everyone when it comes to retiree health care. I think the only other agency that I'm aware of in Oregon that really has a meaningful retiree health care program is Multnomah County, and it's much, much smaller than what we have, and I think much more limited and described. I'd say even in the transit industry, we're head and shoulders above. I think we have the highest other medical liability for retirees of any agency that I know of in the country per employee. So we're way out of line in that regard. When you look at the general comparisons, our general top level operator wage is about 10% over our peers. And then by peers, you'd find the large agencies in the western United States were about 10% on terms of salary over those. And I think the number in terms of benefit, now look to Randy, is about 78% higher than our peers. Is that about, so it's dramatically more than our peers because of that benefit level.
Thank you. And I have just one last
Please.
other question. This is more around the ridership and fare revenue on page 11. So we say that ridership is down 2% due mainly to the free rail zone. So is there any other impact? I guess I'm looking at our discussions last year about transfer and folks not being able to get, one transfer to the other and then to pay another fare. So is there any other, aside from this, ending the free rail zone, is there any other information that we have that has caused that impact?
I don't believe so. I would say that there were really two things that were driving the ridership change overall. One was even before we made changes in the zone structure and any free rail zone, we were seeing a little diminution in rail ridership, and we aligned that primarily to the fare enforcement program. So we saw a 1 or 2% reduction related to that. And then some additional reduction once we ended the free rail zone. And we can track that pretty much entirely to the boundaries of the free rail zone. The interesting thing to me is that we've actually seen the bus ridership increasing. So that would tell me that generally our riders have adjusted to this pretty well. Now, obviously, part of our outreach over the budget process will be to begin to hear what the issues are associated with implementing this program. I'd also note that we are, by the end of this fiscal year, we'll be installing the printers on the buses, the transfer printers, so that this little tissue piece of paper that nobody can read, including me, will be replaced with an actual ticket that is very clear for both the operators and for our riders about the length of time the transfer allows. It'll also standardize between bus and rail, so we've got the same standard. You might recall in some of our conversations with a number of some of our rider representatives that that was a concern early on. So we are, by the end of this fiscal year, we'll have that pretty well addressed, I think. The other thing that we would love to see continue to grow in use is the day pass. We priced the day pass at $250, twice the normal fare of $250. So for $5 a day, people can get unlimited use of the TriMet system. So that's at the same price that they would normally pay to come to work and go home. They can also use it during the lunch hour. They can also use it at night. They also use it other periods of time during the day. So we think that's a good value for people at no additional cost. They get the opportunity for those additional rides. So we're continuing our outreach related to the advantages that offers our riders.
So then, just for my clarification, so if they got the day pass, say at 7 a.m. or 6 a.m., whenever we start, or so it's due
for the whole service day.
For the which is
the last bus in is around 1:50 or so. 2 a.m. Shelley. Yeah. Okay.
Thank
More
you.
like 3 on the line 20.
I'm sorry, Francois, did you get your question answered?
Yes, I thought somebody said something else that I just thought it was.
Good.
Okay. Thank you.
Dr. Bethel?
I'm all set for this right now.
Rosser?
Don't have any questions. I think, you know, as Tiffany indicated, we have been working on a strategic finance plan. And, you know, you saw some more of that this morning, and I think a lot of what we've been working on in the strategic finance plan is showing up here. So I think we're doing good work on bringing that together and really focusing on the problem areas so that we can identify solutions. You know, it's kind of a hard message to take when we identify that, you know, one of the areas that we really have to focus on in terms of some of the union benefits. But it really does come down to a math issue. You know, how do you make the numbers work? And so, you know, I think that's an important thing to keep in mind. You know, we have great employees here. We have great union employees. You know, it's just that things have gotten out of whack, and unfortunately, if we don't make adjustments, we start cannibalizing basic services, and that just doesn't work for anybody. You know, in the region or in the union, for that matter. So it's a difficult message to carry. It's a difficult process to go through. I'm hopeful that if we keep plugging away at it, we'll come out on the other side, you know, a stronger agency and still maintain, you know, good working relationships and good benefits.
Just to perhaps elaborate just a tad, it really is about the math. We emphasize this is probably the most pro-union agency when you sort of come to our personality that you could possibly find. But this is really about the math and about having a stable home for all of our employees. That is critical, not just for our riders, but I think it's critical long-term for our employees as well.